out of 100 people, okay, 98 died, but 2 survived. Those 2 that survived, the antibodies that are in their blood, okay, they were able to make like almost like a vaccine out of that to go out and cure another 100 people. And then out of the other 100, they made those antibodies. They were able to get from there and just so on and just keep building and building until they find something that.
So our technology is it's so advanced at this time that we can find that antibody and put it through the machine and multiply it. So from the same antibody, it's like a 3D printing. We're going to make more and more antibodies, and so we don't have to find the people who just they got treated and they survived Ebola. We can actually use that antibody as a model and multiply it and have those doses. However, it takes a long time to have that. Sometimes those antibodies can be produced either through infecting the animals and getting those antibodies from the animals, or they can do it with the new technology like genetic mapping and
it's almost like you're cloning that, cloning that antibody so that it'll work with everybody else. Sort of like they're trying to do with stem cells, trying to get the stem cells to work with all these other different things, but that's a totally different subject. Another thing that keeps coming up, and it happens every year, and that we're always being told, get that flu shot. Okay, now in the past we've had, there's been H1N1, the bird flu, there's been 100 other different flus. Last year was a real nasty flu season. And a lot of people think, well, okay, it's summertime, I don't have to worry about the fall, it's spring, I don't have to worry about the flu shots, I don't have to worry about the flu here and there. But the whole thing really is that the flu is around year long.
Correct.
And it's just that for some reason, why is it in the winter and the fall that more people get sick from it?
Okay, this is actually a very good questions, and actually it was one of the that's the same question I asked during my medical school training in downstate. And I remember my professor in infectious disease says, listen, something about the influenza virus has multiple different parts, and these parts changes like jigsaw puzzle. So you're not going to have the same virus all the time every season, because different part of it changes, and you have to have a different vaccine. And we predict what flu is going to be hitting us in each, every year. Like 2014 flu is different than 2013 and then 2012, based on epidemiology and science, and to see where these, what type of flu or what brand of flu would come up. Now, why is it more during winter? During winter and fall, it's colder, so people are closer together. They are in the same apartment, the same house, or same school, and they are coming in much more close contact with each other. And flu is an airborne disease. So someone coughs, you get it, you cough, someone else gets it. So if you're in a close environment together, you're going to be having much more episodes of a flu. However, it has happened that people get flu during the summer too. That's not only per se winter. I think winter is a lot more than other season, but flu can happen throughout the year. It's not only during the fall and winter, but the episode and incidents are a lot more, just because people are in the close environments together and they are in close contact with each other.
So getting your flu shot every year, because every year there's a different strain of flu that's coming out. So you can't say, well, I got my flu shot last November, so I'm safe this November.
Okay.
It doesn't work that way.
No. Every year we hypothesize and we predict what brand of flu is going to hit us, and we give those vaccination. However, you also have to tell the audience that the flu vaccine is not 100%. So you could have a flu vaccine and still get the flu, and I didn't get the flu vaccines, and I don't get the flu because I didn't come with the contact of a person who had the flu. And you might came in contact with a person who had a different flu that you got the vaccination for. So it is very effective. It's about 70%, but there's still like about a 30% chance you still can come up with the flu if you don't wash your hand, if you don't, follow the standard of, precautions such as washing your hand, don't come in contact with a sick person, don't go close to somebody, don't kiss somebody who has a flu symptoms, and be careful because it's an airborne disease. I think if you follow those guidelines, I think you're going to help yourself and prevent yourself from getting that virus and that infection.
One of the biggest problems is, like you said, in the wintertime, families are close together, everybody's not really going outside. It was cold last year, 4 feet of snow, so who wanted to go out? But the biggest problem that adults have is that they have kids, they have grandkids, and these things are like germ magnets. It seems your kid comes home from school, and he's sick. Next week, the whole neighborhood is sick.
Absolutely.
And it's crazy. I mean, should they be reinforcing anything more in schools to maybe cut this down?
Do you know what's the worst thing is all the desks in the classrooms or the lunchroom or the gym, right? They don't disinfect it appropriately. I mean, how often do you think they clean those things? I mean, those are if you culture those tables and those surfaces, you see there's a lot of germs, there's a lot of viruses, simply because there are a lot of kids. So kids run around, they don't wash their hand, they just they work very close with each other, they put things in their mouth, they do multiple different things that they're not supposed to because they're kids. And because now in our time, in the household, husband and wife, they both work. So if the kid is under the weather or has a cold or a slight low temperature, they send them to the school, because that's in a way is a babysitter, and you have to go to work, so you can't really miss your work. And that child bring the virus to the classroom, and from there goes to multiple different childs, and it start rotating and rotating. So imagine this scenario and multiply it by maybe 100, and that happens throughout all the districts and all the big high schools and all the different middle schools. And that's why the kids get very sick, because each child bring a different type of a virus to the classroom, and they pass it as a souvenir to the next guy, and that child takes that souvenir and brings it home and shares it with the whole family. So next thing you know, everyone has fever and everyone has cold.
One of the things that gets me, and I've heard this from other members of the audience, is that they're out food shopping, and somebody there is like coughing. They don't cough into their hand. They don't cough into their arm like they're supposed to. I mean, they're just like blurting it out, like communicating it all over the grocery store, and then people get sick. And I can't understand why people don't follow these simple rules, like washing your hands, covering your mouth when you cough. Okay, if your hands aren't free to cough into your arm, right? Just these little things could, really, keep all this sickness down. But you might be out of business if that happens. But
Actually, no. I'm a cardiologist. I don't have to deal with infectious disease as much. However, I love this, and I think what we're doing right now, like having these type of programs to educate the audience, to let them know how they can prevent themselves from getting sick, and how they can prevent their family member from getting sick, is very important. In my practice, I have 3 practices, Middle Island, Plainview, and North Babylon. One of the things that I tell all my patients when I meet them, I say, listen, my job as your doctor is to educate you, evaluate you, and treat you. Education is a big part of the treatment. And it's a job that has to happen throughout the whole system, education system, through the health system, and through even the government. I mean, we do have screenings that we do for the towns, and we educate the community. And because I feel by a small amount of effort in educating the populations can live healthier, and they're going to be more productive, and it's going to be a better environment for everybody. Exactly. That's what I love coming to your show, because I think your show plays a big role in this aspect, because I think this is the only program that actually freely educates our community in Long Island, and it's a very valuable tool.